My name's Paul Wicks. I'm a neuropsychologist by training, and I specialize in the psychological and cognitive effects that ALS can have on people living with the disease. So when people think of ALS, they often think of Professor Stephen Hawking, who had a brilliant mind trapped in a failing body. And it can be tempting to think that everybody with ALS has a completely intact mind and it's only their body that's failing them. In this video, we're going to overturn some of the myths about ALS, where we now know that cognitive and behavioral issues can affect many people living with the condition. So when we think about ALS, we often think of a physical condition that affects the body, causing muscle wasting in places like the arms, the hands, the legs, breathing, or the mouth and throat. But what we now know is that certain parts of the brain may be affected too.
There are three forms of cognitive impairment that people with ALS may experience. The first is mild cognitive impairment, which affects the minds of between 30 and 50% of people with ALS. This mild impairment does not typically affect memory and often has only a subtle impact on daily functioning. It is quite different from a full-blown dementia. Instead, some people with ALS may develop difficulty completing tasks that have to do with things like organising. So if you can imagine planning a vacation or planning a complex dinner where you have to get timings right and you have to figure out what to do if something goes wrong.
So the second thing we think about is called frontotemporal dementia. So classically, when we think of ALS, we think of the motor neurons being affected that control movement. But as it turns out, we also see changes to the front parts of the brain, the frontal and temporal lobes. And what this means is that for a small percentage of people with ALS, about 5 to 15%, they can have changes in their personality. And that leads to behavior that might be unusual or distressing to the people around them.
The cognitive decline of FTD is gradually progressive, similar to the physical decline of ALS. FTD doesn't affect memory exactly like Alzheimer's disease, but in severe cases, it can cause people to use vulgar words, have screaming fits, be unable to control their emotions, and leads to changes in behavior, personality, and temperament.
We can also see some problems with language, such as people getting words stuck on the tip of their tongue, and we can sometimes see people becoming a little bit unreasonable, maybe having a lack of empathy. The third area that we think about when we think about this cognitive change is emotional lability, known by some other names as well, like pathological laughter and crying, or pseudobulbar affect. But whatever the name, essentially it's about this. It's about emotions running away with you. So in the same way that perhaps you can't suppress a yawn or a sneeze or stifle the giggles if you're in an embarrassing situation, people with ALS find it really difficult to suppress certain emotions like laughter, crying, smiling, yawning, or sometimes being angry. So someone might be sitting there looking quite comfortable 1 minute, and then the next second they might be crying uncontrollably, they might be sobbing, they might be weeping at something that's not that sad, like a TV commercial with cute puppies in or something like that. The impact that that can have on the person with ALS is they can feel very distressed, like they're not in control of their body or in control of their emotions, and the people around them find it really difficult to know how to react. And really, it's important to say that emotional ability can be quite separate from cognition and behavioral issues and things like that. It can be a really specific issue for some people with ALS, particularly if they have symptoms in their throat and mouth, the bulbar symptoms. It can be a little bit more common. So the types of examples we see are either where they have a more exaggerated form of the emotion, so they're starting to tell a joke and they can't get it out because they want to laugh so much that they laugh over the punchline, or that it's sort of incongruous. It's not showing how they really feel. And so some of the examples that we hear are people laughing at a funeral, which would be highly inappropriate, smiling and laughing out of context, out of character, or crying when actually they're feeling really happy to see somebody. Today, what we tend to do is newly diagnosed patients should have a screening, just a short 10 to 15 minute assessment that can be done by a neurologist or a neuropsychologist. They'll ask them standardized questions, trying to get them to name things or come up with words off the top of their head, maybe do some memory tasks, that sort of thing. And we'll also ask a series of questions to the person living with ALS and their caregivers around them to see if there's been any changes from before they had ALS. So one of the key take-home points here is that if you experience a person with ALS that has emotional outbursts like anger or laughter or crying, not to take that personally. It may be that the person with ALS is not feeling that way. They might even be feeling the opposite. And that it may actually just be part of their illness, part of their condition, that's making that expression come out more strongly. For many years, we didn't think there were any cognitive or psychological symptoms in ALS. And now that we know that that's not true, we certainly need to identify them, we need to put plans in place to be able to react to them, and we have to make sure everybody's aware that these can happen. But that's not to say that the person with ALS is no longer in charge of their care. They are. They are the person living with a condition who knows more about their own needs, their own preferences, and what they think is important to maintain quality of life. So what we must never do is, if we disagree with a person with ALS, try and say, oh, that's the frontotemporal dementia, or that's the cognitive change, and you're not being reasonable, or you're making a decision that's not in your best interest. There have been some studies that show when looking at very important decisions that people with ALS can make, like the decision to have a feeding tube or to use a ventilator, that actually these milder cognitive issues that we're talking about don't play a significant role. So it's important that we don't use this as an excuse not to listen to the person with ALS. It's their voice and their opinion, their views, their strategy for how they care should remain our number one priority.
It can be devastating for friends and family, and very distressing for you, their caregiver, to see these changes in a person with ALS. It may be hard to work with a person with ALS with a condition, but it's important that you approach these patients with compassion and professionalism, even if they're giving you trouble. Remember that these are symptoms of their disease, and their behaviours should not be taken personally.